Hello, this is Group 3's presentation on Provision 3 from the ANA Code of Ethics for Nurses. We focus on the nurse promoting, advocating for, and protecting the rights, health, and safety of the patient. The provision is divided into 3 sub-provisions in which we will review. Sub-provision 3.1, Protection of the Rights in Privacy and Confidentiality. Explanation. So, all individuals have a right to privacy. A nurse must continuously protect these rights. One way to protect privacy includes limiting the disclosure of health information. This includes limiting access to both written and electronic records. Be sure to put away charts or log off the computer when you leave. Also, be aware of your surroundings when discussing patient information, such as when you're reporting at shift change. Speak low or in a private area, and remember, when talking to a patient, always ask permission to discuss confidential information when they have a visitor in the room. An example of 3.1 would be HIPAA. HIPAA protects all patient rights to privacy, which includes those who have access to the patient's medical records. Such confidential information may only be released to individuals other than the specific patient upon signed consent or with the presence of a court order. Many are unaware that hospitals, clinics, and private practices are allowed to charge reasonable fees for the materials and labor due to handle patient health information. Thus, medical staff are trained to ensure the right patient receives the correct documents, which protects theirs and others' privacy. Also, penalties of HIPAA violations have severely increased over time. It is proven that prevention of errors in managing protected health information is best. So an example of a HIPAA law would be patients who choose to pay out of pocket for their health service rather than having a claim submitted to their health plan, which may indicate that their insurer does not have access to the information about the service. This situation occurs when a patient wishes to hide their medical condition from their employees, and the patient legally has this right. So the importance to protecting privacy seems obvious, as most of us would expect nothing less. But remember to take into consideration a patient's wishes and rights for privacy at all times. An individual may not want certain medical information disclosed to certain people or even their place of employment. Also, by not adhering to this provision puts a nurse at risk for legal matters as it violates HIPAA. So what can happen? So a hypothesis would be, without this provision, patient information would not be protected, identity theft would be a problem, and the trust between a patient and nurse would not be formed. So hypothetically, our right to privacy would not be protected. Medical records may be carelessly left open for prying eyes to see, leading to increased occurrences, as I said, of identity theft. The average medical identity theft victim pays $13,000 out of pocket to resolve it. 3.2 is the protection of human participants in research. Human subjects are often used during research in order to obtain adequate information about the research factor that is being studied and its effects on humans. This part of the provision ensures that well-being of these human participants while the research is being conducted, regardless of the method of study that is being used. There are several protections in place that must be met before using human participants. However, even with these protections in place, there is still room for risks, and in some cases, such as the ethics of microbial challenge studies. An example would be a misconducted research experiment in the U.S. that was performed in Guatemala. There are many methods of research that has been deemed unethical, especially when human participants are being used. This is typically due to a lack of safety precautions being met before initiating the experiment. There are several facilities that deem human research studies unethical, including the Center of Disease Control, or CDC, and the National Institutes of Health. Importance would be to ensure the safety of individuals agreeing to participate in research studies and to place the well-being of participants above the results of the research experiments. It helps to ensure that the research are being conducted safely when human participants and places the well-being of the participants far above that of the experiment. Supervision 3.2. So what can happen? What could be a potential outcome if these protections were now put in place? Well, first and foremost, human research experiments would be much more forbidding for the human participants. This in turn would make it more difficult to find humans who would agree to participate in such studies. Without necessary safety precautions in place before initiating experiments, it would likely be that most, if not all, human research studies were deemed unethical. It would also place a huge liability on the facilities conducting the experiments in the case of any harm done to the human being used for the research. Provision 3.3, Performance Standards and Review Mechanisms. So nurses should be responsible, accountable, and professional. And nurses must understand the basics of performing their jobs efficiently and abide by the standards before working in the field. Nurse educators, managers, and executives are responsible for ensuring that nurses are being met the performance standards for their nursing field. Maintain confidentiality is a really important aspect. Nurses should know how to protect patient documentation and complete documentation accurately. Nurses should know how to document information that may be needed at any given point, especially in an emergency situation. Review mechanisms are opportunities for nurses to receive promotions in their careers as a reward. An example of implementing performance standards and review mechanisms would be nurses continuing education by research, evidence-based practices, and improved methods in the professional nursing field. The research may consist of more efficient practices or scientifically proven adjustments to current methods in order to perform optimal patient care. So this means not doing what you are used to do simply because it's what's comfortable to you, specifically when it's an outdated method. Continuing to update your methods of practice to improve the quality of care for the patient and better patient outcomes. New ways that may be more efficient and ultimately safer. You can also do this by continuing education and taking classes annually to ensure current methods are being acknowledged, especially if the nurse has been out of the college practice for a while. Also, an example of review mechanisms is when a nurse is rewarded for doing an excellent job with a promotion or pay raise. With promotions, the nurse may take on more responsibilities due to the performance of the nurse going above and beyond what is expected. A pay raise can be just as effective when reviewing a nurse's past efforts and realizing their work ethic has maintained or exceeded standards. So, an important thing about 3.3 would be nurses must understand how to take care of any given patient, no matter how severe or minimal the patient's problem may be. Nurses must have the ability to apply their knowledge to any patient effectively. So it's not just about memorization, it's about actually doing and making an action towards that patient that can be helpful. If there is an issue, nurses should handle the situation in a professional manner, following standards by the healthcare facility and using techniques to swiftly problem solve from nursing education and research. Without performance standards, nursing level of care provided to the patient would be inadequate. They wouldn't be held responsible for their poor quality of care, and errors would increase due to a lack of education of current trends. We would also see poor patient outcomes increasing. Without a review mechanism, you would find nurses feeling less motivated. Just like when we have rewards in class when we answer a question correctly and get a piece of candy, you tend to find more students participating, and the same thing goes to any job. It's important to keep nurses motivated. Although many nurses may be considered natural go-getters, giving 100% no matter what, it is important to ensure that all nurses want to go above and beyond, especially because it's the patient's lives that are at stake.